Hi, yes, so it is possible for people who are mentally and physically disabled to abuse their medication. So, Zach writes, I'm very curious if it is common for people who are disabled like this to divert and abuse their medication to try and get some form of a high. Like, are they smart enough to do this even if they are mentally disabled? Hi, my name is Dr. Natalie Jones, and I spent years working in a skilled nursing facility slash hospice slash rehabilitation facility for my internship. And yes, it is possible. And in fact, in my original post where I was talking about skilled nursing facility, hospice, and so on and so forth, in the place where I work, substance abuse was a very big issue. In fact, even people who are disabled, a lot of people that have, again, forms of dementia and things like that, who are in places like that, they do struggle with depression and anxiety, first of all, from being in a facility, and well, I should say, first of all, from even having the disorder, because a lot of disorders, even though they're physical, will bring on mental health symptoms. In fact, that's usually the first sign of a debilitating physical ailment or an autoimmune disease or some disease of some sort is symptoms of depression, which are usually sort of dismissed or attributed to something else. But also too, they get depressed from being in the facility. They get depressed from not being surrounded by family members and loved ones. They get depressed from essentially not being free to do whatever they want to do and have their own free will to go out and live their life the way that they want to, or the way in which they are accustomed. And so in addition to dealing with whatever sort of repercussions that their physical ailment, if a person is bedridden and they can't get up, they may have other sorts of physical ailments. And I've worked with people with a variety of ailments that have, had them bedridden either temporarily or, for an extended period of time, from Ehlers-Danlos syndrome to being quadriplegic, paraplegic, any number of things like that. And so a lot of times people may have comorbidity, which means that they also have some sort of issue with like pain in addition to mental health symptoms. So whatever got them to a skilled nursing facility, or whatever has them in a skilled nursing facility or a rehabilitation facility. So a lot of times pain can be comorbid, and so people can be on pain medications, and sometimes they're not. But a lot of times they start out being on prescriptive medications, and they may become addicted, or they may feel like they need more just because the psychological symptoms are playing a factor, hence which is where I came in and helping people learn how to manage chronic pain. That was one of the things that I used to do both in individual and group therapy, is learning, helping people sort of separate like the psychological urge or the mental urge for medication versus the actual need for pain management and things like that. And I've done that even outside of that, because this is something that takes place in outpatient care as well, where people just become addicted to medications. But in addition to that, like I said, substance abuse becomes an issue. So people start to need more and more substances to cope with being in a facility. So people may develop alcohol use disorders. People can also and do have drugs, so illegal drugs in facilities and things like that. In fact, that became an issue when I worked there, so much so that people had to be kicked out due to criminal behavior, such as drug usage and things like that. And also, one of the other things that also develops in addition when people are trying to support their addiction in facilities is stealing. So there's other issues where people actually, where residents will steal from other residents to support their growing growing addiction habit. So they will go in their other rooms and steal money out of their purses or steal gifts and things like that, that family members and things like that bring for them. So stealing and other antisocial behaviors where, you know, there's been, and I hate to say it, but there's been times where there's a development of like a pimping and pandering situation that has developed where people are using other people and bartering and trying to get their needs met. So criminal activity exists and is very rampant actually in skilled nursing and hospital care, and people do develop addiction as well as other behaviors to support that addiction. But great question. Thanks for asking.